All right. Hi, everyone. I am Rupinder, and today we have with us Dr. Esha Chainani, who's an OBGYN resident. And she's also partner with Shakti Shalini, and she has an app called Prema app, which kind of provides information on sexual and reproductive health to women. And it's a multilingual app. It's a great initiative. And it's great to have you here, Dr. Isha. And today we can talk about menopause. It's a process. It's something that has been overlooked in a way. Not much is said about it. There's a dearth of research. When you look at the knowledge development around the topic, it's still limited. It's still inadequate, and it's a process which is as normal as menstruation. And it is also like it's a natural process in aging, basically. But unfortunately, it's not much talked about. So that's what we're going to do today. We are running this campaign called Let's Talk Menopause this week. It's going to go on till the 18th of this month, and 18th October has been designated as World Menopause Day. So this entire week is dedicated to it. We will be providing information to you around the process. We will be talking about mental health. We will look at the representation in media as well, which is limited again to some jokes and some sketches around women just getting hot flashes, and that's pretty much about it. So we'll talk about experiences and all. So today we will talk about menopause. And Dr. Isha, first basic question that I'm going to ask you is, what is menopause? And yeah, if you could just go on, and then we'll go again.
Yeah, sure. So basically, menopause is looked at like a natural eventuality, like periods, stop, and that's when women grow old, things like that. But what we fail to take into consideration is that it's not an easy time in any woman's life, and every woman goes through it. Like, it's a long process. It's got a lot of problems involved. There are physical manifestations, psychological, emotional, all of it.
Yeah.
Also, we've got, society that ties a woman's, womanhood and your femininity with your childbearing abilities. So, if you cannot bear children, if you don't have any periods, that means you're not a woman, or you're not a woman anymore. And then you're just like old and decrepit, basically. And, menopause basically it kind of heralds this change where you go from being like a fertile woman into being just this old, person. But basically, what menopause is that it's the end of your menstrual cycles, because your hormonal, like your reproductive hormones, like estrogen, progesterone, testosterone, all of those hormones start reducing. So the actual definition, so you've hit menopause when a woman has not menstruated in more than 12 months.
Right.
So basically, that's what it is. The average age of menopause around the world is 51, but it's much lower in India. So the average age of menopause in India is actually 46 years of age.
Okay.
So perimenopause basically starts anytime up to 10 years, even before that.
So perimenopause is basically the first stage. If you look at it, it's something that happens before menopause, right? Okay. Yeah. So
exactly.
Yeah.
Perimenopause is something where your hormones basically begin to change, start to lower down, kind of fluctuate quite a bit in preparation for menopause.
Right.
And it's not like a linear process, if you know what I mean. It's not like a fast decline or just a decline. So perimenopause is when they can go up and down, and just all of these things that happen, and then eventually it sets into menopause. So it can last from a few months to a few years, sometimes even up to about 10 years you can be in perimenopause. Some women can skip perimenopause and enter menopause suddenly as well. That does happen as well. So it's not just like a one size fits all. It's different for every woman. There are also a few factors that determine menopause. So the age of menopause, it's different for every woman. So it depends on a few things. So example, if you've had your first period at an earlier age, you will hit menopause at an earlier age. If you had your first period at 16 or 17, then you may hit menopause a little later.
Okay.
Also, things like the age your mother was when she had menopause.
Mm-hmm.
If you have, history of irregular periods, if you had, a lot of children, your physical activity, your smoking, high fat diet, all of those things actually, affect the age you go into menopause.
Hmm. Okay. So is there a particular diagnosis? Is there a way of finding out? Are there tests? I mean, any other things?
So it's basically a cumulative process of basically your clinical diagnosis, which
Mm-hmm.
is all the symptoms of menopause,
Right.
and also with your age, and also we rule out things like thyroid function issues, prolactin problems, if your liver and kidney function are not right, so
Mm-hmm.
things like that.
Mm-hmm.
Also, one of the most fascinating things is that you can still get pregnant when you're in the perimenopausal state. So you may think you've not got your period in like 5 months, but I mean, just because you're 40 doesn't mean you can't get pregnant.
I think that's
So
one
we
of
do
the
rule out
misconceptions. That is one of the
exactly.
misconceptions. Yeah.
So
Yeah.
we do rule out pregnancy as well, even if you come in at the age of 45.
Mm-hmm.
So things like that. If you do, I mean, there are a few blood tests that we do to confirm menopause, but usually it's a clinical diagnosis. If there's no other kind of problem, like if you don't have any big fibroids, if you don't have
Right.
any endometrial problems, things like that, if we
Mm-hmm.
rule out anything else, so then we usually diagnose it as menopause. Otherwise, if you want to definitely confirm on paper, then we can do hormones like estradiol, which is a form of estrogen. We
Right.
do serum, FSH, and LH.
Okay.
But again, not commonly done.
Okay. Not commonly done here. All right. I also just
Anywhere, not just here. Like it's
any.
not.
Okay. It's quite rare. That is okay. Um, it's further divided into two, right? Menopause is divided into two. One is premature and also surgical menopause, right?
Yeah,
So if you could tell us a little bit about that.
sure. So menopause. Premature menopause, or we can call it primary ovarian insufficiency, we can call it premature ovarian failure, there are a bunch of words for it, is anything before the age of 40. If you hit menopause before the age of 40,
Mm-hmm.
it is premature menopause, basically. Surgical menopause is if for any reason they have to remove your ovaries
Okay.
or your uterus and ovaries.
Mm-hmm.
So if they remove just your uterus, so that's called a hysterectomy,
Mm-hmm.
then you will still have the hormones that are there, because the hormones are still released and created by the ovaries,
Right.
but you will not menstruate. But
Okay.
the other stuff, you will still be able to have the same level of hormones and hit menopause at whatever age you were originally going to.
Mm-hmm.
But if either just both your ovaries are removed or your uterus and ovaries are removed, then you will not menstruate and you will also hit menopause. So
Okay.
example, if you're 38, 42, for some reason you've had to have your ovaries removed, then that's called surgical menopause.
Hmm.
Also radiation therapies for
Okay.
any pelvic cancers, things like that. Also some kind of chemotherapy, which is
Mm-hmm.
your hormonal chemotherapy for some kind of breast cancers, also
Right.
hits your ovaries as well and causes surgical menopause, is what we call it.
Okay. Okay. So if we can now come to the symptoms, if you look at what are the common symptoms, and we've heard about, of course, it affects one's physical as well as psychological health. And the some common symptoms that we hear about, like hot flashes, there's vaginal dryness, etc. So if you could talk about those.
Sure. So this is actually a worldwide like research statistic.
Right.
3 out of 4 women going through menopause suffer from one or more of these menopausal symptoms,
Hmm.
which is basically like everyone. Also, they can start during perimenopausal the time, extend during your menopause year when you're not having any menses, and sometimes can continue beyond a few years of menopause also.
Okay.
So it's not just that they will stop. So these are the symptoms. One is the most like earliest sign, most common sign is your irregular menses.
Right.
So they may be less frequent, or you may have heavier or lighter periods than you normally experience. So sometimes it becomes less consistent. Flow may become heavier and longer. Usually you could have been bleeding for 3 days a month sometimes, and it'll start becoming 5 days in 2 months, but you're changing twice the number of pads that you used to, things like that. Sometimes it gets lesser and lesser, sometimes it fluctuates a bit. So just irregular menses could be heavier or lighter, either of them. Then we have our vasomotor symptoms, which are hot flashes, night sweats, and flushing. So about 75% of women experience hot flashes. Then we have things like insomnia, vaginal dryness, weight gain, difficulty in losing weight, difficulty in concentration, memory problems. We have a reduced libido, which is very important. That means like you don't feel like having sex, you have no desire or urge to have sex. Dry skin, dry eyes, UTIs could be frequent, increased urination, sore, tender breasts, headaches. Sometimes you may have palpitation, sometimes painful, stiff joints, backaches.
Right.
Hair loss, hair thinning is also another major symptom that women do experience, along with headaches as well. Psychologically, they do have mood swings. There's anxiety, depression. Again, very, very high chances of developing those.
Right.
Then one thing I'd also like to touch upon is once you get into menopause and once you're menopausal or postmenopausal, because estrogen and progesterone are reducing, which are your reproductive hormones, they're actually very protective when they're around. But when they start reducing, you have higher chances of having osteoporosis, which is weaker bones. You have higher chances of heart disease. You have higher chances of developing a heart attack. You have higher chances of things like vaginal atrophy, which is very, very dry vagina, which causes something called dyspareunia, which means pain during sexual activities. Slower metabolic function, which means it becomes very difficult to lose weight. You start gaining weight more, so you may be trying everything to lose weight, but it gets very difficult. Things like that. Higher chances, again, as you age, of cataracts, of teeth problems, and all of that as well.
Right.
So
yeah. So when it comes to osteoporosis and cardiovascular diseases as well as cancer, I think it's in the next follow-up stage, which is the post-menopausal stage, right? So is there a duration, and ignore my ignorance, but is there a duration of menopause too? And then what is what is post-menopause then?
So basically, the year where you're not getting any menses, or that's the year that you call that your menopause.
Right.
Menopausal.
Yeah.
So once you hit it, it's called menopause. After that stage, you're called post-menopausal. So from then until like the day you die, you're basically post-menopausal.
Right.
So that's just like a word given to people that's after menopause, basically.
Right.
And peri is around. Peri basically means in Latin around. So basically perimenopause is around menopause. Menopause is just like an event. And then we have post-menopause, basically.
Okay. And I mean, looking at the number of symptoms that an individual has to go through, it's a lot for a person to take, and it's important to find support, etc. And especially since we're not, unfortunately, the information, what the misconception is that an individual, it's about physical changes, but no, it's also about psychological changes, and like you said, anxiety, etc. And it's important to, I think, see a doctor then as well, especially if you're undergoing all those things.
Definitely. That's why I think it's very important to kind of normalize the fact that menopause is not easy. Right. Just because every woman has to go through it does not make it easy, or that's just what it is.
Hmm.
Now I think we've got such an improvement in mental health care facilities. There's so many psychologists, psychiatrists that are there. There's so many non-profits, like including you guys, that
Yeah.
actually give you access, or even free access, to mental health professionals, and health, like care lines and critical care lines, and
Yeah.
all of those lines are available. There's so much available. We have to make it more normal that anyone can use it. You don't have to be labeled as
Right.
crazy or like insane to like just use it, or that you're like a mental patient or anything like that. So every woman
Hmm.
going through menopause potentially
Hmm.
could undergo depression or anxiety or mood swings,
Yeah.
irritability, things like that. And
Hmm.
a lot of these things also push mental disorders more into the foray. So example, if you are bipolar from before,
Hmm.
going into menopause can push you into, say, a manic episode, it can push you into a depressive episode as
Right.
well.
Hmm.
So I think, because mental health is not just depression and anxiety, it's a lot more to it.
Hmm.
So I think it's very important that we normalize that even menopause is something that women, all of us, do need help for, and there's nothing wrong with it.
Yeah, absolutely. I think recently only, I'll just quickly tell you about this incident. We had a cloth pad distribution drive, and we were holding workshops. And I think there was one lady who was around 48 years old, and she asked, I've not bled in the last 4 years. Is there something wrong with me? So she did not know about कि एक time पे आके periods बंद हो जाते हैं. So she wasn't aware of it. And we told her, of course. So there's no conversation, even in societies, even if women get together, it's just a taboo. So not menstruation a taboo, still trying to break it and moving on.
Reproductive health, women's health is a taboo. That's
Right.
the I think that's one thing that we really need to see, that in like all of it, it's not just anything to do with women's health.
Right.
It's not even like, forget just contraception, like anything, even like pregnancy, like talking about your pregnancy, talking about problems in pregnancy is also taboo, because it's
Yeah.
supposed to be the best time of your life.
Hmm.
So things like that, even
Yeah.
like menopause, like, oh, everyone goes through it, like why are you like making such a big deal out of something?
Right.
And it's not even talked about, like how menarche is, like
Hmm.
when you get your first periods, that's not talked about. So how will this be talked about? So I think
Yeah.
I'm so happy that you are opening the conversation to this, to so many people, because it's so
Absolutely.
important. Yeah.
That is true. And I mean, now that we're talking about, and I think we'll move on to the next section also, which is about managing the symptoms, as well as what are the lifestyle modifications that an individual can make when it comes to handling these symptoms. So yeah, if you could tell us about that.
So, one of the biggest things that I've gotten as an OBGYN, and as someone who has a mother who's in the menopausal age, so mother's friends, all of that, is hot flashes. I
Right.
think that is everyone's like biggest issue. So
Hmm.
basically, let me just actually touch upon what a hot flash is before, like, it's basically a sudden feeling of heat, and like sometimes like a redness on your face. You get flushed, you start sweating, you may
Hmm.
have palpitations, you may have chills, you may have a very rapid heart rate.
Hmm.
So that's basically a hot flash, where suddenly you're sitting in a room and you suddenly start to get palpitations, you start feeling very hot, you get red, you're sweating. I've actually seen it happen. It's very sudden, and like you don't, like, the woman going through it has no idea. She just like, it's so
Right.
hot, it's
Yeah.
so unbearable, like I don't know what to do, I don't know how to deal with it. So it's a very distressing kind of feeling as well, I'm sure. But that's basically what a hot flash is.
Hmm.
That happens at night when you're sleeping. It's called a night sweat.
Hmm.
um, now what is a hot flash? Basically, it gets triggered by a bunch of things. So, if you're prone to getting hot flashes, it could be because, so things like hot weather, anything, if you're exercising also in a room which is heated, if you're sitting in a hot room, all of that, that's a trigger. Smoking, caffeine, alcohol, spicy foods, all triggers for hot flashes. Tight clothing, heat, which is, I think, mostly in all of India, there's a lot of heat. So again, that's why I think a lot of Indian women do have a propensity for more hot flashes. Also, stress causes hot flashes as well.
Right, right.
So basically, avoid all of the triggers. Once you are getting a hot flash, try to kind of understand that this is what it is, this is what I'm going through. Take a few deep breaths, go sit in like a cold room, drink some cold water, go have a cold shower, things like that could help. Exercise again helps. B complex vitamins, vitamin E, again, very shown to help. Then we have things like, there's something called evening primrose oil, which I have read about, but there's no actual research that has been done that proves that it works or it doesn't. But I mean, you can try it if you want. So that's basically hot flashes. Another very common symptom is backache. So backache is very, very common in menopause, and especially after that as well. That's because one, osteoporotic changes, you have lower calcium levels than you did before, and your vitamin D is also low. So basically, calcium supplementation is very important when you're hitting menopause, and especially after that, accompanied with vitamin D. Also, exercising, low resistance flexibility exercises, using ice packs, basically taking care of yourself, noting that there is a problem and then doing something about it. A lot of us ignore all of these symptoms, like, oh, it's okay, it's just a backache, I'm just tired, like, we'll see tomorrow, not a big deal, not a big deal, and then kind of it turns into something way worse. So I think just acknowledging that this is a problem, what can I do to fix it, and that self-care, I think it's very important. Women as a whole, I think we try to we think that we're not as important. I don't know, it's like we're taking care of everyone else, especially once we get older. We take care of our families, you take care of your husband, your children, your in-laws, so you kind of forget that there is you to take care of as well.
Yeah.
So, especially around that age, because your kids are growing up, you're thinking about all of those things. So all of that. So I think you have to take care of yourself and see that you come first. So, just acknowledging that these are symptoms, and, that. Otherwise, mostly basic things you can do to manage menopause symptoms is manage your weight, exercise 30 minutes a day, practice relaxation techniques like mindfulness. So on my Instagram page, which is Prema Health, I do a daily mindfulness exercise. So I started doing it for myself, and then I thought, let me just share it with whoever follows me on Instagram. So it kind of gets people to also do it, and it's actually personally helped me quite a bit. Then things like breathing, yoga, tai chi, all of that. Hydrate, very, very important. Hydration is very important. Quit smoking, reduce your alcohol, manage your sleep. Also, I think for sleep, you can take a magnesium supplement as well, that's shown to help in case. Basically, the most important two things are a diet and exercise. So diet, if you can Google Mediterranean diet or an anti-inflammatory diet, which is basically higher in protein, no processed foods. Also, like basically just your normal Indian balanced diet, like your regular ghar ka khana, is actually very, very good for you. Right. So more than anything, more than any fad diet, like just like just ghar ka khana, like. So I think that's very important.
Yeah, and also I think in case of supplements, if somebody wants to take, I think you should check with the doctor first. It's absolutely important to kind of check whether you can add supplements to your diet. And so like we've talked about managing these things, managing the symptoms. What if they're extremely severe? what to do, then are there treatments available to manage the symptoms in some other way?
So definitely. So let's first talk about like smaller things. So example, if you have a lot of hair loss and you're losing a lot of hair, you can try. We actually prescribe minoxidil to put topically on your hair. Sometimes, if you have a lot of vaginal dryness or pain during sexual activity, things like that, which is again very vaginal dryness is very common and very underreported. It usually presents as itching around the vagina as well. So that we usually give estrogen based vaginal lubricants.
Right.
So these creams basically. So we can do that. If you have insomnia, if you have any psychological issues, should see a doctor.
Absolutely.
Otherwise there's something called HRT, which is hormone replacement therapy.
Right.
Which is basically, usually we give it for your early menopause, which is if you hit menopause before 40, or premature ovarian failure, things like that, to continue your hormones till the time that you naturally reach menopause.
Right.
Or if you have very severe symptoms of menopause, then we do give HRT, which again, it's got a very bad rep in society, but it's I think it's given at the discretion of your doctor. And if we think it is important for you, we know that the risks will, like the benefits will outweigh the risks. And there are a lot of studies, research studies that have been done showing that it is safe, and things like that. So there are a lot of misconceptions about hormone replacement therapies, but honestly I think if your doctor thinks it's the right thing to do, then it is the right thing to do, because I think your doctor has the best in mind for you. We're not gonna give anything risky or anything that's gonna cause you more harm in the future than anything else. So I think that's about medications for menopause.
Right. And of course, again, please check with the doctor before, just
Exactly.
have a conversation with them, looking at your symptoms and how severe they are and how they are affecting you. You should check with your doctor for sure. Talking about misconceptions and myths, so one definitely is that it's not just in your 50s that menopause can hit. It can be before. And early menopause is something that we will be discussing this week. So stay tuned for that. But thank you, Dr. Esha. That was great. We will be talking about post-menopause tomorrow. So Dr. Esha will give her inputs again, and we'll be putting them out. So thank you so much. And it was great chatting with you. And we are trying to get the conversation started around the topic, and it just does not end with this campaign. We wanted to go on further ahead. So thank you so much for watching, and stay tuned for more information. Thank you. Thank you, Dr. Esha.
Bye. Thanks.
Bye.